let's get underway. And I'd like to invite up to the stage the three individuals from the Department of Health. So please come on up and let's have a conversation. In just a moment, we're going to start. We're going to start with Sheila Sjolander. Did I say your name right, Sheila? Sjolander. Carla Berg, and from the state lab, Victor Waddell. So we have in Arizona a really sophisticated process of creating a kind of a plan for health and improving health and making healthcare more effective in this state. And there's a health improvement plan. One was done earlier, the first one for 2016 to 2021. We're not going to talk about that one. There is a brand new one. And Sheila, let's start with you.
Great. Thank you so much for inviting us to join you this morning. And I have to say, in regards to thinking about what to focus on in our very short time together, we landed on the Arizona Health Improvement Plan because it really captures the most important thing that we need to be working on over the course of the next few years to really make an impact on health. So the plan itself focuses on a really small number of impactful priorities. It's informed by data. We do a 5-year state needs assessment or health assessment, and that is updated annually. And most importantly, it's built in conjunction with partners across Arizona. So it is not an ADHS strategic plan. It's really intended to be a plan that reflects the work of multiple agencies throughout the state that are working together to improve health. So in the new rendition of the plan, we have 5 priority areas. So we're going to touch on each of those very quickly. And I want to just make note that health equity, you see, is cross-cutting. It's seen as the foundation of our work. It is a standalone priority in our plan, but it also is embedded in each of the other 4 priority areas. So a look at sort of how we journeyed through the process of developing a health improvement plan. We published a 5-year state health assessment in 2019, and that data, as well as lots of community input, work with our partners and our Arizona Health Improvement Plan Steering Committee, helped lead us to a selection of the current priorities in early 2020. Of course, COVID hit and delayed our planning a little bit, so we launched core teams looking at building out 2-year action plans in each of those priority areas and published the new 2021 to 2025 plan in June of 2021. In the fall, we did launch the implementation team, so we have each of the priority areas has fabulous teams that are meeting at least quarterly to work together to move those action items forward. In December, we published a summary of accomplishments of our very first AZHIP, Arizona Health Improvement Plan. That plan had like 17 priorities, so pretty ambitious. So we have a summary of accomplishments in that publication. And most importantly, we had released a pandemic recovery and resiliency plan as part of the Arizona Health Improvement Plan in December, so anxious to share that with you today as well. So our implementation continues. So first, we're just going to quickly highlight each of the priority areas. Health and all policies, social determinants of health. It was an easy decision for a core team to make to focus on housing. And our vision really is no one should experience homelessness. Health should be embedded in housing policy, and having a home is foundational to having optimal health. So making the connection between health and housing really important. So we have 4 strategies in this section of the plan. The first is really focused on coordination of services and embedding health into policies. So one of the things that's been accomplished is our friends at the Arizona Department of Housing did enhance their integration of health considerations in their qualified allocation plan, which is a plan that sets criteria for developers who access the low-income housing tax credits. So important work moving forward there. The second strategy, increasing financing and funding tools. So that is really the work being done to support families through eviction prevention, homeowner supports, as well as building up housing affordability stock. The third strategy is really about connecting people to services and improving those systems of care. So one of the things that's embedded in the plan is the work that Access and Contexture are doing to stand up the closed-loop referral system. And the fourth strategy is implementing strategies in a manner that ensures cultural humility, racial equity, and health equity are a priority. So one of the things that we're doing there is working with Home Matters. Arizona Home Matters is coordinating a number of partners to organize around some collective messaging around the importance of home and health. And so we're part of that process. Also, we have released a grant opportunity that we're reviewing right now that focuses on advancing equity in the priority areas. The next priority is mental well-being. So this is intended to be a broad statement of whole person well-being. And we have 3 focus areas in this priority area. The first is continuing the hard work on reducing opioid use and overdose fatalities. So some of what's been done in this work is Access stood up a opioid services locator. It's a real-time locator, so we're really excited to have that up and running. We're also able to launch and distribute fentanyl test strips, which was a policy that was put in place last year by our state legislature that enables that to occur. The second strategy, improving awareness of and impact of social isolation and loneliness on health. I think this is for me, one of the most exciting areas of the plan. And we, as a health department, we had intended on embracing loneliness as a public health issue long before the pandemic hit. But obviously, its attention on those issues is even more critical now. So last fall, ADHS did launch a new social connectedness campaign. It's called Let's Start a Conversation. We intend to build out more messages and more tools around social isolation and loneliness. We have published a 50-state review of what's happening across the country in this space, and lots of work being done with partners there. And the third strategy is reducing suicide-related events. Last fall, Access and ADHS worked together, and we transitioned the lead for suicide prevention from Access to ADHS. So we've been kind of regrouping on that and have a fantastic new suicide prevention program manager, and we'll be releasing a new statewide suicide plan shortly here, and we have a stakeholders meeting tomorrow. But some of the work in that plan is supporting the new 988 rollout, as well as continuing training for suicide prevention, including mental health first aid and youth mental health first aid. And then rural and urban underserved. So this really recognizes the severe disparities that these populations in particular have faced in Arizona. So we have 4 robust strategies in this priority area. The first is work addressing health professional shortage areas, really focusing on building out the diversity of the healthcare workforce. So that's work being done in conjunction with the area health education centers. The second strategy is looking at better utilization of community health workers and community health representatives in clinical settings. And we're really excited at ADHS to be nearing the end of the rulemaking process. So soon, community health workers can seek voluntary certification. Then the third strategy, improving Indian health, increasing access to care, reducing barriers, and strengthening infrastructure. That's work being done in conjunction with the Arizona Indian Healthcare Council. With Kim Russell is here today, so we're very excited to work with her on moving that work forward. And the fourth strategy, improving maternal health outcomes, is work that has been launched a couple years ago through a maternal health action plan, and involves lots and lots of strategies, including work with hospitals. We have most of the birthing hospitals in Arizona are working on implementing some safety bundles that will improve maternal care, working on campaigns that and education that focuses on post-birth warning signs. So I am going to pass it over to Carla to talk about the next two priority areas.
Thank you, Sheila. So as Sheila mentioned, health equity and addressing health disparities is a foundational priority and woven throughout all the priority areas in different ways in the strategies and tactics. But we felt we really wanted to have an intentional focus with a health equity priority. And so you see here the vision that has been adapted from the CDC definition, and time again from the state health assessment data and what we've seen in community health assessments are very clear disparities in a lot of different areas, ranging from morbidity to mortality. And so the three focuses that this group identified is in the areas of data and the ability to strengthen the collection of data, community partnerships and engagement, and really ensuring that we have mobilization of partners throughout the state. And three, which is in what's referred to as PSEs, or policy systems and environmental change. And so this work group, co-chaired by strong partnerships of externals, we have really great work related to building out social vulnerability index, or the SVI, within the data component. So better understanding how do we identify and understand our data a little bit better. How important is it to collect the right data to give us the story of where we are facing disparities and where we can best address them. Within community partnerships, this area has a lot of co-creation of structures and identifying and bringing in the right partners for those conversations. And then within PSEs here, it's really a strong focus on evaluating what application and initiatives have already occurred at local levels, and how do we evaluate and identify those best practices so that they can be then leveraged in other communities. This priority is really important to us for a lot of different ways, and one piece that was new within 2021 was a new funding opportunity by the CDC to help support addressing COVID-19 health disparities. So ADHS was able to apply and really support for our rural communities. Maricopa and Pima counties were also applicants on their own. And so our partnership here was a really strong partnership with the U of A Center for Rural Health. And it looks at different ways that we can focus on these data areas, identify mobilization, data collection, and mitigation and prevention efforts around COVID-19, but that can extend and be sustained for the future. So as, So as Sheila identified the timeline, you'll see, and was mentioned, the pandemic was throughout this time in the development. And so the first four priorities were already established, but those work in the action items really work conversations that occurred while the pandemic was going on. And throughout those conversations, we knew there needed to be something more that really spoke to the impacts of the pandemic. And so early on, we identified what could this look like, and we identified a fifth priority, which is the Pandemic Recovery and Resiliency Plan. So it was developed throughout the late 2020 2020 and 2021, and it was published in early January of 2022. And it took into account where we were, the new assessment that we needed to capture. And the 4 areas that came about was strong opportunities that were very much seen through the pandemic in addressing our public health capacity and infrastructure. So those systems that were in place. We know that not only the public health workforce itself, the traditional workforce, but all aspects of the public health system were tested and strained throughout the pandemic. Through different reasons of underfunding and historical impacts, we know that we needed to do more in this area. So where can we identify workforce challenges? Where can we better support our workforce, building out pipelines, understanding that the impacts of mental health, stress, and burnout were very real for all of our healthcare system and partners. So this area has a really strong focus on how we can support that better, ideas and opportunities for the creating pipelines into those workforce sectors. The second area was around the public health system and infrastructure. So this also really hits to those partnerships. Where were there better infrastructures and partnerships in place that could be leveraged to continue? Where were there opportunities through the pandemic? Some of these really focusing on how surge was better supported. What did that look like throughout the state? And that's the second goal that's identified here within this plan. Third, again, we always wanted to have a focus on health equity and addressing those health disparities. So we saw that consistently throughout the pandemic in Arizona, unfortunately, with communities that were disproportionately impacted, not only in cases, but their inability and opportunities that were identified in seeking higher levels of care, but we saw it within challenges of distribution of vaccine and therapeutics. And so over and over, we identified how can we better set initiatives that focus and support these areas that we know where there are disparities. And in the fourth one, the fourth goal, this was a large goal, but it's really focused around the resilience of communities. We know even just nationwide, 140,000 youth lost their caregivers during COVID, due to COVID. What does this look like? We know that 4.5 times greater this impact was seen among our American Indian and Alaskan Native children in the United States. So how can we better support those individuals, those communities? How can we address adverse childhood experiences? How can we be better trauma informed? And how can we really look to those systems and resiliencies that need to be in place and that could be sustained, again, throughout the pandemic and in the future? This plan was also identified as an opportunity to tie in what's referred to as the SERP, or the Statewide Emergency Response, I have to look down, Response and Recovery Plan. But it's really focused around health and social services. And so you'll see some strong connections there throughout this plan about how we can better tie, and we bring in a lot of places for system navigation and better preparing ourselves for connecting individuals to social service needs. So what we see here is continued implementation. We have some really great implementation teams and partnerships within our co-chairs, internal and external. And as Sheila mentioned, we currently have a grant opportunity that's being reviewed and hoping to better support this. So as we see funding opportunities that tie in, whether that be funding that the state receives or that local health departments receive, identifying how we can best leverage those funds and supporting and knowing that these plans really build out a framework that can then be supported with initiatives.
Okay, Victor.
Okay, great. Thank you, Carla. Great to see everyone this morning, and thanks for inviting me here to talk. Good to see everyone face to face after probably more than 2 years of not having those virtual meetings. I'm glad to be in the room today. So I thought I'd talk a little bit today, about the Arizona State Public Health Lab that I oversee, and also the Arizona Biomedical Research Center. And so with the with the Arizona State Public Health Lab, many of you are probably familiar. There tends to be at least one public health lab in each state. We have one here in Arizona, along with a smaller one in the county health department in Maricopa County. And so we support all of the testing for the state. And so if you can imagine, along with the routine testing that we do, from newborn screening to rabies testing, to environmental testing, to any of these white powders that close down buildings that you see that come to us for testing for anthrax and a whole range of other things. We also had to deal with the pandemic situation and ramp up our COVID testing. So I thought I'd mention some of the challenges that were presented to the public health lab over the past couple of years with the need to ramp up that testing to support testing within the state. We had to bring on additional instrumentation, and as many of you know, there were a lot of challenges with the supply chain issues. Lots of things like even as small as the little pipette tips that you use for most of the lab tests today were challenging to get. They were only made in a few countries in the world, and so those things were challenging. So we had to bring on a whole range of instruments to be able to test for COVID, so that if we did have issues with the supply chain, we could switch to another test and we could continue to do the testing that we needed to. Obviously in Arizona, to test all of the population, we wouldn't have the capacity at the Arizona Public Health Lab, so we had to actually reach out and work with our partners in Arizona, and those were the commercial labs and also the university labs that we work with, and so they were able to ramp up quickly and support us with testing capacity. One other thing also that we needed to do was bring up our next generation sequencing capabilities, both at the commercial labs and also at the public health lab, to be able to support that surveillance for the various variants that you see out there, such as Delta, Omicron, etc. So that really pushed the boundaries on our ability to ramp up that testing and those capabilities within the state, so that we could have an idea of what variants were circulating within Arizona and compare that to what we've seen nationally and also internationally. We also got into a lot of activities, that we didn't typically do at a public health lab. They were things like, in the early days, we were asked to help provide and push out remdesivir to some of the facilities in Arizona. We were also requested, as you know, there was a shortage of testing. There was also a shortage of test kits, and so we were able to acquire certain test kits, should it be the antigen rapid test kits or also the other rapid molecular tests, and push those out into the community to help be able to support those testing activities and try to enhance the capacity for testing as it was needed. And so we certainly had those additional challenges that normally we wouldn't get into. We had our public health lab. We have a large area for training that was taken up with additional testing that we needed to put in that area. We also have a large conference room that some of you may have been in. It's like a 60 to 90 seat conference room that obviously turned into a storage facility, so that we could store all of our supplies in there and have those supplies. And as many of you know, even with some of the collection kits, such as the little swabs and also the collection media, became really challenging to get in the early days of the pandemic, until we were able to work with the Department of Health and Human Services and other groups at the federal level, so that they could acquire some of these test kits and bring them in even from other countries, so that we had those available to push out into the community in Arizona, so we could continue to do testing during the pandemic. There were also a lot of other challenges, as many of you know, with data. All labs were required to report not only positive but also negative lab tests, and so you can imagine the challenges with that, with a lot of our old systems in many labs, trying to push that data to the state health department or push that data to HHS and CDC as was required. we also seen a lot of challenges, and you probably also did as well, with a lot of entities bringing on these rapid tests. And we've heard about the advantages, disadvantages of a lot of these rapid antigen tests. Certainly there's a place for those tests during a pandemic, and I think they played a role in our response to the pandemic. But certain challenges with some of those tests is, the ability to get data back from them. And I think some of our future challenges really will be, as we get a lot of this at-home testing, as many of you have been able to even go online, order rapid tests, get them delivered to your home, use those tests to be able to advise you on what steps you might want to take next in terms of your health care, or not visiting people who may be more vulnerable, etc. I think we're certainly going to see a lot more of that at-home testing. And one of the challenges with that is, how do we get that data as public health? How do we get that data that we rely on for surveillance purposes? And I know some of those systems are connected up electronically to where they feed back into CDC and into the state health department, but many of them, as you've probably all done throughout the pandemic yourself, have done those rapid tests and got a result. And it's not always clear, should you report that? Do you need to report that? Or would you report that if you were going to report that? So I think as we move forward with a lot of this at-home testing will certainly become more common, and that's one of the challenges that's presented. How do we get that data so that we can act on it as public health? Certainly, one of our big challenges going forward, certainly from the lab perspective and also public health perspective, will be, will we continue to get some of the funding that we've gotten over the past year or two? I know there's been quite a bit of money thrown at public health, and a lot of us, certainly at the lab, have had challenges trying to spend that on what we need to fast enough with all of our government systems that it has to go through. So I think there'll be certain challenges with that going forward. Will we continue to get funded, and will we continue to be able to support the capacity that we've built, certainly at the public health lab, for future pandemics? And also, I think one of our biggest challenges, as we all know, is really the public health workforce. And we certainly see that considerably. It's certain challenges throughout the whole pandemic, and even now as the pandemic sort of passes and we get towards that endemic phase, we're certainly seeing the challenges with trying to hire people to fill positions at public health labs, and indeed even commercial labs, university labs. There's not the same amount of people coming out of school with those appropriate qualifications, and we've known that for many years. But also, I think the pandemic has, there's been a high demand for folks that can do testing, and so we've all been challenged with trying to maintain our staff and how we're going to move forward in the future, and how we're going to have access to that next generation of lab technicians and lab scientists, etc. And then lastly, with ABRC, ABRC, for those of you who aren't familiar, is an entity that gives out tobacco tax and lottery funds to researchers in Arizona. So a lot of the money goes to university researchers, other researchers at hospitals, etc. And so the pandemic certainly did affect the ability of those researchers to continue the work that they get funded from ABRC. They typically get a 3-year contract, and they use that funding to do the research on biomedical topics, basically. And so, as we know, the biomedical and research community is extremely important here in Arizona, important for the economy, important for the healthcare of folks. And they did certainly have certain challenges with their workforce and their ability to continue their research. Fortunately, I think most of them are back on track now, but some of them were delayed in their important research due to all the challenges that we all faced with staff being ill, issues with being able to get into those research labs in the early days after the pandemic started, and various restrictions that were in place. So again, I think we're we're in a better place now with those researchers. They've been able to continue on. We've given them a bit of leeway in terms of extra time to spend some of their funding, because we know the impact of the whole pandemic and what it has done to their research. And so, you know, we're hoping moving forward there we can continue to give out our funding so that that critically important research can continue in Arizona. And I'll stop there and turn it back over to you, Vern.
Okay, well, thank you, Victor and Carla and Sheila. We have time for just a couple questions, but let me just follow up on a little bit of what you were saying, Victor. So you're there in the state lab. You have access to some of this data, although with home testing, it's a little hard to know sometimes exactly where we are. But how will we know when this pandemic is over?
Yeah, I think we'll, obviously the data is the main thing, and with less of that data coming in at the minute, with less testing going on, as we all know, we all seen the lines of testing back several months ago. Those have all disappeared now. And I think that's going to be one of the challenges, is to when all of the health officials and the county health department officials feel comfortable that they think we've reached that endemic phase to where we know that the virus is going to continue to be around. It's going to be a bit like potentially the flu, to where we know, you know, there may be waves that we see of this over time at certain periods of time in the year, and what things can we put in place to better our surveillance. Because if you imagine, we've been doing this for many years, certainly at the lab, with gathering information on flu, and so we don't test every flu sample in Arizona that people submit, but we test subsamples from various parts of the state, and through that we can build up a picture of what when flu is circulating, how intense it is in certain areas, and then we can work with the public health officials to put interventions into place that are going to help try to reduce the spread of that. And I think with COVID it's going to be similar.
Yeah, great. So there's so much to follow up on. I wish we had a lot more time. One of the things that struck me in both what you, Sheila, and Carla talked about is the role of community health workers. And that's a new thing. How is that going to work, especially on the health equity issue, on issues like maternal and infant mortality and so on? What's coming with community health workers? That's a new thing.
Well, I would say Arizona has actually a very long history with community health workers embedded. I think since the early 80s, if I recall correctly, even Kim is saying even before then. Definitely has been part of the maternal and child health structure for many years, supported through grants, but also with chronic disease. And I think healthcare systems now taking more advantage of employing community health workers, I think, is where we're headed now in the future, particularly after the licensure goes into effect, or it's actually a certification, but it will allow, that really kind of clears the pathway for insurers to feel comfortable reimbursing for those services. So I think that's a huge step forward in our state to uphold and embrace the community health workers and their critical role in really meeting people where they're at, connecting people in their own neighborhoods to services, and getting them the information and help that they need.
Carla, this relates a lot to the rural health issue as well.
Yeah, I think there are just some great opportunities to better identify strengths. I think a huge part of mobilizing communities is building on community strengths, and I think those individuals within those communities are usually those the benefits that we see there. They are trusted. They can really help to translate just in terms of what the health messaging looks like into something that's tangible, understanding the limitations that may be in place in certain communities, or just the realities of rural communities. And so I think there's some really great partnerships that we have within the structure through different groups, whether it be ASCHO, which is the Association for Community Health Workers, the Center for Rural Health and the Regional Office of Border Health. So there's just a really great opportunity there, but really builds upon the strengths that are already existing in communities.
Yeah. So one of the things that's really striking about the health improvement plan is the statement of health in all policies. So that cuts across things that aren't typically thought of as, health issues. Can you say a little bit more about how health in all policies is playing out in what you do, in access, and so on? Yeah.
Sure. There's a lot. So I think even in our first rendition of the Arizona Health Improvement Plan, we had a built environment priority, which included transportation strategies. So like looking at transportation systems and how they can support health and how neighborhoods are built, how general plans and city plans are created with health considerations in mind. So as we're designing neighborhoods and roadways, land use planning, hugely important in terms of health considerations, where we're designing new, even where where are we locating affordable housing units? Are they right next to highways? So those are just some examples, I think, of important ways in which health in all policies is being integrated into the thinking. We certainly have a ways to go in that regard in terms of how to institutionalize it even more, I think, than it already is.
Mm-hmm. Carl?
And I think a piece to that, just to add, is that it could be very little p to big P, and I think that's the important factor of just so many different opportunities from the setting. So it could be a workplace setting that helps to support health for the workforce and the individuals served. It could be at schools. Just having that consideration and seat. Sometimes it's a seat at the table, but consideration of the health impacts and how those can be better supported within any policies and infrastructure that's set in place in a variety of different settings.
Yeah, so this is social determinants in action. Yeah, so we have just a minute or two, so let's kind of look to the future. When we get to the end of this 5-year period of time that this plan applies to, where are we going to be? What's the objective? What are we trying to achieve, and where will we be in 2026 when this is? Yeah.
So a big piece being that the plan is data-driven is that we would anticipate that the specific actions and tactics really help and get us to a better place where those indicators that the data shows us, there are opportunities, are improved. And so there are a variety of different health indicators, a variety of different impacts throughout the lifespan is how we frame our state health assessment from birth all the way looking at mortality indicators. And so we really see the opportunity for the vision and the goals to be met, but to really see us having moved the metric, moved the meter on those indicators that are so critical to ensuring that we have enhanced life expectancy and better health outcomes at all levels of life for Arizonans.
Yeah. Sheila, what can you add?
I think Carla said it really well. I think that we have a lot of momentum we can build on right now, so I'm excited about some of those opportunities, and it feels like the future is changing right under our feet. Things are just moving so rapidly, and we don't know what's coming next on any given day. So it's a little hard to predict, but I'm hopeful that by 2025 we'll be in a much better space. Particularly, I hope in regards to mental well-being and mental health would be my personal vision and hope, and in a better space with the housing situation in Arizona as well.
Yeah, longer lives, healthier people.
And I would be remiss if I didn't say that the integration of health equity everywhere, everything we do as our first thought, I think, is so critical as we move forward.
That is a perfect place for us to finish. We are out of time. Please join me in thanking the Arizona Department of Health leaders.